Hi, I'm Dr. Dewsnup. I'm an audiologist with Happy Ears Hearing Center in Phoenix, Arizona. And I get a lot of questions about tinnitus and have quite a few patients who come in for treatment, mostly because it's driving them crazy. I can't tell you how many patients come in who tell me, I don't want hearing aids, I just want my tinnitus to stop. That is an impossible ask, and here's why. Tinnitus is most commonly the side effect of hearing loss, and it's usually from damage to the tiny little hair cells in the ear and damaged nerves in the ear. Most people who have tinnitus have some form of high frequency hearing loss. And when you have an untreated hearing loss, certain parts of the nerve are not able to detect sound and wake up until you have enough sound stimulation in that specific frequency range to wake them up. So let's take a look at this audiogram. So this is an audiogram for someone who has a hearing loss in the high frequency range. They have pretty normal hearing in the low frequencies on the left side of the graph. So they might feel like their hearing is normal. But on the high frequency side, they require quite a bit more volume to just barely hear the tone like a whisper. So most of the tones on the graph, all of them, are the patient responses when the volume was decreased to the point that they could just barely detect it, essentially like their whisper level. So that means in order to activate that part of the nerve, they will need more than 70 to 80 decibels in that range to even hear it slightly. And most people just aren't stimulating their ears with that much volume in their everyday environments, unless they work in a loud environment. So with this type of hearing loss, if you aren't using hearing devices to stimulate the nerve and wake it up, you will never be able to reduce the tinnitus because it's too quiet in that frequency range to activate the cells that really need the volume and are still functioning. So that's why most people complain about their tinnitus and why they notice it more at night or when they're in really quiet environments. The best way I can relate sound stimulation to treating tinnitus is this. Picture a junior high band. You have one kid on the trumpet that is just squeaking the trumpet obnoxiously, like tinnitus. But nobody else in the band is playing their instruments yet. So you're hearing this annoying kid just squeaking that trumpet, being loud and distracting. Now, even though he's squeaking his trumpet, some few more of the instruments start to play and warm up their instruments and just warm up in general. And it helps just a little bit to kind of tune him out so you're not hearing that squeaky trumpet as much, but you're still hearing him. So it would be similar to someone who maybe has hearing devices, but they're not appropriately fit or they're under amplified in a certain frequency range, so it's not activating those cells. Now picture the entire band playing their songs, playing at the full volume level that they're supposed to play at. You're not going to hear that squeaky trumpet, and if you do, it's going to be very minimal because the rest of the band is playing at the level they should be, and they're all masking him out. Similar to having hearing devices that have sound maskers or are appropriately fit to stimulate that part of the nerve where that hearing deficit is. So hearing aids are the number one treatment for tinnitus, and I'm sure you've heard that before, but there is a reason for that. That's because you can stimulate that part of the nerve with sound, and then that helps to reduce the tinnitus. Other types of tinnitus can be caused from medications, from concussions, things like that, and it can be, there might not be a hearing loss present at all. So most people will notice it at night when it's quiet, or it really bothers them in certain situations when they're just sitting in a room and there's no sound. And so that's in situations at night, you can use like tinnitus pillows, you can use sound machines, you can use other things. But if you have an untreated hearing loss, or if you're trying to treat it in a way that you think you're saving, money, but it's still not helping, it's not going to work. So we see people who come in all the time that say, I got my hearing aids at Costco and I still can hear my tinnitus. Well, that's because they're not programmed properly. Like, they're not meant, if they don't do real ear verification, if they're not making sure they're stimulating that part of your nerve, if they're not making sure that maybe you need a sound masker or some type of pitch masking in a certain spot, or masking on a device that you can activate when you are in a quiet environment, then yeah, you're still going to hear it, because if there's not enough volume coming in to wake up those tiny little cells that might still be functioning a little bit, but they just need more volume, then you're still going to hear the tinnitus. So hopefully that helps to explain why hearing devices are the number one treatment for tinnitus if you have a hearing loss. But it's hard for me when patients come in and they're just like, I do not want hearing aids. I just want my tinnitus to go away. And it's impossible. That's an impossible ask. So hopefully this helps. Hopefully it makes you think about tinnitus a little bit differently and why it's so important to treat it. It's important to go to an audiologist who does real ear and who is familiar with patients who have tinnitus so that they can appropriately program the devices for you and also give you some other solutions to help in different types of settings that you might be in.